Capitation is a method of payment developed by insurance companies to try and lower the cost of health care. Each member has to choose a primary care physician when they join the plan. The provider receives a specific amount for each member each month. They receive this amount regardless if the patient is treated by the physician or not. Capitation plans are usually one of two choices. First, the provider bills the charges to the carrier and receives a set amount per member per month. Second, no billing. No billing is required and still receives a set amount per member per month. To set up our capitation payment, we need to do three things. First, we need to set up the capitation financial class defaults. Second, set up the capitation account. And then third, show you how to post those capitation charges and payments. So first, master files to financial class default. For example, let's say that we have a capitated plan for an insurance company, maybe Blue Cross Blue Shield. So we'll type in the code, hit the tab key, and then spell it out. And then whatever the name of the insurance company is, I like to type in capitated so I know that this is a capitated plan. Now when it comes to setting up, we have our allowable write-off. We want to click the ellipsis button and choose the write-off for capitation. Next, we want the cap write-off to be set to yes. And also we want a cap write-off code. And again, I'll choose my write-off capitation. Be sure to select your default account type. Usually 9 times out of 10 will be your typical. Click Save. And then once you save it, it adds over here so you can select it and make any changes and save again. And when I'm finished, we'll close out. Step number 2. Set up the capitation account. You're going to set up the capitated carrier as a patient. Why? It can be very time-consuming to spread a lump sum payment from the carrier out over the patients in the plan. So instead, the user can do it all in one, the patient as the capitated carrier. To do so, up on the toolbar, we'll click on the patient button, and then enter in the insurance or capitation insurance information here, just like we would for a patient. Now in this example, we were saying that Blue Cross Blue Shield was our capitated insurance. So just like when we're entering in patients, we want to enter in the insurance name, last name, comma, first. In this case, I'm typing in Blue Cross Blue Shield, the first name, last name, capitation. Type it in however you'd like, but for me this is the easiest. Hit the tab key to make sure it doesn't automatically pull up in the system. And then in responsible party name, you can type in the same name as the patient, or what might be a little bit easier is to have Advanced MD do it for you later on. So in other words, if I type in the word self and hit the tab key, and after I save it, when I log back in, it'll automatically pull the patient's name if the responsible party is self. Now of course, be sure to enter in the address, and then the zip code. Now if you set up your system defaults to require date of birth or social security number, click on the date of birth arrow. And in this case, maybe you want to set this date up to when you actually had the agreement set up with your capitation Blue Cross Blue Shield. I'm going to double click on any date, and then for social security, I'll type in all zeros. Finally, we have our financial class. Now if you recall, we set that up just a little bit earlier. Click on the ellipsis button, find your capitated financial class, and double click on it. Also, we need to tie it to the correct provider. Click on the ellipsis button, find the provider, and double click. When we're done, be sure to save your work. And then finally, the last step is we want to click on the Insurance tab and enter the capitated carrier as the insured. So what we're going to do is going to click the ellipsis button, find the carrier. Now if you haven't entered in the capitated carrier as the insurance carrier, in other words, it's tied to itself, then click the ellipsis button and click Add New. And as we went over, type in the insurance information for the capitated carrier. Once you've typed it in, click Save, and then after it saves, you can do a search here. I'll type in the letter C and click Search, and you can see I already have mine entered. I'll double click on the Blue Cross capitated, and then be sure to click Save. And the final step is posting the capitation charge and payment. Now to post the monthly lump sum from the capitated carrier as a charge and then as a payment, first click on the Patient button, and then pull up your capitated insurance patient. First enter in the charge, click on the Transaction Entry tab, and then click on the Charge button. Up at the top here, choose the date of service for the range that you're receiving for that payment that it represents. So let's say it's November 1st through November 30th. And then enter in your capitation procedure code. Now, if you don't have one created, you can click on the ellipsis button here and then click Add New, and then type in your capitation procedure code. Since I already have mine in the system, I can double click and it'll pull up. When you've typed in the information here, at least the procedure code and the display description, go ahead and click Save, close out. You can do a search here and then click the search button and then double click on your capitation plan. After you have your code up, type in the actual fee or the amount, in this case of the check, $3,000 we'll say, hit the tab key. Then after I hit the tab key, I want to make sure that the units is always set to 1, otherwise 30 times 3,000 is going to be 90,000. So let's set it to 1 unit, so it's back down to 3,000. Also, you want to create a capitation diagnosis code so we can process this charge. And again, if you haven't done so, click the ellipsis button and then click Add New. And again, since mine's already in here, I type in the letter C, hit the tab key. If it doesn't automatically pull up, I can click the ellipsis button, and there it is. Double click to select it. If I need to make any changes, that's fine. For you, you can go ahead and click Save. And then once you saved it, you can actually close out and simply type in the letter C here for the diagnosis code and hit the tab key, and it automatically populates. Finally, we can go ahead and click the Add button to add the charge down below. And then next, we can go ahead and click OK and Pay to process and post the charges, and then go right into the payment entry screen. Now in the payment entry screen, because it's pulling up on the patient, you're going to get a little pop-up window. To select the visit, click Cancel because it's not coming from the patient's source. It's actually coming from the insurance that's making the payment. So down here you'll see the line item for $3,000. Type in the total payment amount of $3,000, hit the tab key, and then the check number. And then finally, go ahead and click OK to post the payment. Once the payment's posted, you can click on the History tab, select all items, and you'll see that $3,000 has been paid for from the payment range of October and then the payment range of November. You can click your plus sign to see what was paid and applied. Advanced MD will write off all patient charges and bill them as $0 claims with each day's close. Claims are billed one time. It will not be picked up if trying to rebill.